Hey, welcome to part two of this series. The first series I talked about 8 years. What have we done? Where did we come from? And where were we going to land when I got to this part, which is here we are today. What's it look like? What's it feel like? There's so many things happening. It's like, where do you even begin? So I'm going to begin by telling you probably the biggest news today is Dr. Clara Strunk has moved to our community. She is fresh out of residency. She was due to residency up in South Dakota, and if you listen to her talk, you can tell she was very close to Minnesota. And she is beginning her training, orientation, reading all the policies, getting to know the staff, all those good things. Pretty excited about it. So adding to our medical staff with Dr. Clara Strunk, we have Dr. Abelai, Dr. Farmer. We have PAs Lisa Stuckey and Jill Burbank, and nurse practitioners Maggie Myers and McKaylee Kirby. So we've got just a full slate of, I would call them just family practice, good hometown kind of people taking care of our folks here. I couldn't be prouder of this team. Now, we have a clinic in Spearville that opened in the fall of 2019, and we added a clinic in St. John. It's celebrating its first year actually this month. So we're pretty happy about that. They have made it through their first year of being Edwards County Medical Center, and we've got new signage out there. The clinic looks great. We get a lot of good comments. I hope if you're in St. John, drive by, see it. If you get a chance, stop in. They always got goodies in there and some great coffee. So stop in and say hi to them. The Midway Clinic, you may have noticed, it got a new entryway. The old entryway was a little bit hazardous. We had several people that were victims of tripping on it, falling, getting hurt. And then out front, we also had the barriers so you park your car, your tires hit it, and we had people that were falling over those. So when we put the project together to give us a new entryway, we wanted to have kind of a spot between the doors so people could come in, be able to be cleared to come in should the pandemic hit us again. So come in, have an area out of the weather while they're being cleared to come in. But we also wanted to make it so that when they got out of their car, there were no trip hazards between their car into the facility. And we created that. It works great. We couldn't be any happier. We made our waiting room bigger. We got new chairs, new signage. We got new lights in there. You can almost get a tan. It's so bright in that waiting room now. And we just love it. So hopefully you can stop by. But probably the biggest news out of that whole project, which is going to sound kind of silly, but we got a generator. The clinic had not been on generator power, so when the power went out for a day, or one time it was out for almost 4 days, we ended up having to have services provided up in the treatment rooms up by the emergency department. So this will allow us to continue to see patients even in downtimes like that, and we want to thank our local folks, neighbors, Electric, for helping us with this project and getting that generator put in. It is amazing. We also, today as we stand, have the placement of the new helicopter landing area. That allows patients that need to be airlifted out of here by helicopter to move from the facility directly to the helicopter without having to be loaded into the ambulance and driven around to the west end of the hospital. If you're not feeling well or you have something broken, let me tell you, the less you have to be put in and out of or vehicles, the better. So this helps greatly in getting patients out to the helicopter pad quickly and with less interruption, less bumping, less injuries, and certainly saves time as well. So we're really excited about that. Our specialty services, as we stand today, consists of women's health services, and I'll talk about that just a little bit later here. Kinesiology, mental health, behavioral health counseling, podiatry, respiratory therapy, pain management, cardiac services, general surgery consults and scopes, orthopedic services. But we also have things like cupping, dry needling, and aquatherapy now to our growing list of services that are provided by our own rehab services. Our rehab department is on the go and on the grow, and we're excited about everything that they can bring to the table to support all of these other specialty services. And the list is just continuing to grow. So keep checking back and hearing what's next. Today we have a solid core team of staff providing services throughout the spectrum of the hospital. A lot of times we hear about providers that are coming in and specialty services, but we don't hear about what's happening with our staff. We have a grow your own philosophy here, and many of our staff members that have come to work here have advanced in their degrees. They've advanced in the things that they can do, and also in their certifications, maybe their licensure. And it's really exciting to see that happening. If you go into our clinic, for example, most of the staff that are working down there are now medical assistants. And so they have advanced beyond maybe being a nurse aide to this other level, which is very high tech in some ways from the amount of education that they have and the things that they can do compared to maybe just the general scope of services. So we just keep adding to the things that we can do and growing our own. We watch our own staff. Some of them have come to work here in one area and have witnessed something they really like or love, and they pursue that. We've had people that are going to school right now to be nurses and medical providers that maybe worked here in phlebotomy or as nursing aides, and it is just exciting to see that this is coming back. It helps with what is called the brain drain, where people from small communities tend to move into larger metropolises, and we're trying to keep them coming back home, trying to help them grow and be able to achieve their goals and their career dreams right here in Kinsley and in Edwards County. And so this is something that's really important to us and to our board. You know, right now we do have about 95 employees, and most of them are full-time. And they're not just hospital employees. I mean, when we think about people who are on payroll, let me tell you who they are. They're your neighbors. They're volunteers in our community. They're parents with children in our schools and daycare centers. They teach Sunday school. They use local businesses for their home needs and for their hobbies. And the list goes on and on. Our staff members are also community. They serve on other boards. They serve on church boards. They're helping out with communion on Sunday mornings. They're working second jobs. They're taking care of their neighbors when their neighbors aren't feeling well. That is what we bring to the table, is a dedicated staff that are more than just drawing a paycheck here. They care about our community. They care about the people that they see and work with and live with and take care of. You know, we contribute over $5 million each year in salaries to our community. They say that every dollar that is spent in a salary rolls over 7 times in a community. You get paid, you buy groceries. The guy that's selling groceries, Jay down there, he's paying his staff. They're getting insurance. They're buying cars. They're going out for supper. This money just continues to roll over and over. $5 million each year in salaries goes into our community. Our equipment is current. It's not antiquated any longer. Our floors, our lighting, and nearly everything in between the floor and the lights is pretty recent and operable. We have supported dozens of staff in reaching their education goals. We're partnering with a company right now called CLS, Continuous Learning Systems, to apply ways to improve our morale, our customer service. We want to do better. Our board wants us to work hard on making sure that our public and our staff know how much we mean to each other. So we're constantly trying to get better at that. We work with a company called DNV for annual accreditation. We don't have to do this. It's not required. We could wait for CMS to come in every 5 or 6 years and survey us, but we chose to work with DNV and be surveyed every single year. We do this because we know it makes us a better, safer place for our community to receive care. And when the board said we're going to do this, they also liked the idea that in the first 3 years, we would find ourselves on the threshold of being what's called ICO 9000 certified, which is a testimony to our commitment to always assure that we're holding ourselves at the highest standards of safety and quality care. And if you walk around our facility, you'll see it, you'll feel it. It's real. We have an affiliation right now With Pratt Regional Medical Center, it allows us to share resources, training, leadership development. It's a very trusting relationship that is critical in this day and age. You need to know that the hospitals you're affiliated with have your best interest and theirs in mind when taking care of the patients. They like to see our patients come home. They like to communicate with our physicians and APPs. They want to have a talk with them because it is a true partnership and understanding that we are one. We're afforded the opportunity to send leaders to their leadership development classes and workshops. They advertise, they include our affiliation as a focus point on most of their social sites and billboards. When we have new employees that need to have skills boosted in an area that we don't do a whole lot of, they will allow that employee to leave here and go over there and work with their staff and get some additional training. It is working well for us. Our staff and leaders also participate not only in local boards or on local boards, but they also participate in regional and statewide committees. They serve actively on advisory teams, advisory boards. They're helping planning annual events. They're providing information at these big meetings, but they're gathering it and bringing it back. And so this small hospital here in Kinsley is finding out what's happening all over. We're excited about that. That's us today. We're working on bringing dermatology services to Edwards County Medical Center, which would be a huge addition to our offerings. You know, Dr. Stiles is here, busy with scopes. Our pain management clinic has added yet another day to their services due to the growth of the program. Dr. Steckley added a half day a month to the ECMC schedule, and he's full. And it just seems like we're growing and growing in the specialty areas. We continue to offer MRI, nuke medicine, mammography, bone density right here at home. Jackie Forsberg, I mentioned I would talk about her a little more. She's going to be joining us beginning October for Women's Health. And she already has a growing list of patients. If you've been talking to your doctor, you need to get in and see someone. She works with and under Dr. Espinosa. I would talk to your doctor and say, hey, get me in while there's still a chance, because she's going to fill up fast. And we're just ecstatic about having her come in. A few other things I just want to mention is we do have a new roof coming. You'll see some more construction going on this year. The old roof it's a flat roof and it just develops leaks. And we've been chasing leaks for the 8 years I've been here. Well, this year we have the roof, the contract complete. The roof products have been ordered, and everything that's part of the old hospital will be re-roofed and should have 20 to 30 years of life on this new roof. The storm shelter, as I mentioned, it'll hold about 55 people. And the storm shelter is complete. We went out and looked at it. You can probably see some pictures here pretty soon, even out on our social media, of our board standing inside of it. They love it. And it may not hold 55 people when we push a hospital bed or two in, because that takes up more room. But there's room for about 55 people to stand in there. That isn't for the public necessarily. That is being reserved for patients and staff. And there are times when, of course, we have too many people to fit in there. We still have the old area of the hospital that we've used as a tornado landing spot or shelter spot for our staff. So we do the best we can. But this new shelter is exciting. Drive by and take a look at it. It looks pretty impressive. It's out on the north end of the hospital by the new helicopter pad. Otherwise, that is pretty much what's going on. And be prepared, because soon I'll be telling you where we're headed. What's our strategic plan look like, and what you can expect at Edwards County Medical Center. And as always, don't hesitate to stop in, visit with me, write me an email, give me a call if there's anything I can help clear up or anything we can do to help you. Thank you so much for all you're doing for supporting us.